So there are many different types of technology in mental health care. So let's look at all the different types of technology that we typically have within our field. And especially we're seeing more and more of these emerging here in recent years. Obviously, we have email, we have texting. And, texting is one of those things, so is email, where that may be agency specific or practitioner specific. There are practitioners that do exchange emails with clients or text. There are also other practitioners that do not. So there's going to be continuums for a lot of these different types of technology that we use in our field. Virtual reality, have you all heard about this? That we're seeing more and more of an emergence of using virtual reality in mental health treatment. And there are more and more virtual reality programs being developed. We're seeing those more now in like clinics, like your larger scale clinics that can afford to purchase the software and the devices. But it would not surprise me if in the next 10 to 15 years, we see more virtual reality within our field. Computer programs. So there are different computer programs now that are available to help people with their mental health. The one that I'm thinking of that comes to mind is called the Coping Cat. It is a CBT program for kids, and it's basically like a game, and it has the kids follow along. You're walking along the street and your friend kicks you in the knee, or, it's not going to invite you to the party. What's your thought? What's your emotion? And it gives you different options. And so we're seeing more and more of these computer programs, especially for younger people, because the reality is we know a lot of younger people use technology. And so therapeutically, what we're finding is one of the ways to reach young people is to use technology therapeutically. So that's where you see more and more computer programs being developed, specifically computer mental health programs that can be used in psychotherapy to support clients. Blogs. We're going to talk a little bit later about blogs, but we see that there's a lot of either agencies or individual practitioners that maintain a blog. And so that is another form of technology used to reach people, to provide opinions, information, education, and resources. Social networks, Facebook, Instagram, LinkedIn, X. I'm sure I'm forgetting some, but looking at lots of different social networks and seeing, what should a therapist presence be within social networks, personally and professionally? How do we manage that? Telephone. So the good old-fashioned telephone. We still do provide some telephonic services to individuals. I've supervised social workers that have provided exclusively telephone services to individuals around grief support, specifically to older adults. And so we do have some agencies that their care plan and their vision for care is largely going to be happening over the phone with clients. Video conferencing. So let's say, for example, that you need to have a meeting with a client. Let's say you're working with a client that is a minor, and there is a school conference happening with the school social worker and the parent and you as the outpatient provider. So this is going to be happening over a video conferencing. Computer games. So kind of like the computer programs, but computer games is that game-based therapeutic way in which we work with individuals. Instant messaging, podcasts, artificial intelligence, and then can you all think of any other types of technology that we use in mental health care? Let's look at a particular case study here. This is Wade. Wade is a therapist, and I'm going to read this particular scenario to you about Wade's client. The safety plan for Wade's adolescent client dictated that she call Wade, a therapist, whenever she felt like cutting herself. But instead of calling, the client kept texting Wade. When Wade responded by calling the client back to try to de-escalate the situation, the girl would hang up on Wade, insisting she didn't want to talk. The client would then explain the whole situation via text. I clearly had an ethical obligation to communicate with her, but I needed to do it in a way that she was going to be receptive to, says Wade, who's a member of the ACA and also works in a group counseling practice and working towards his doctorate. We discussed the lack of confidentiality regarding texting and my uneasiness about it. But the fact of the matter was, I had to do what was in the best interest of my client. And in that situation, it was to text and calm her down that way. So the reason why I share Wade's experience is it gives us a really good insight into the ethical dilemma that can arise for a practitioner if you've done your best to try to set up these avenues of communication and you have here an adolescent. And we know, and not to stereotype, but we know that generally adolescents often will prefer to text versus talk on the phone. They kind of roll their eyes about talking on the phone. It's old school. They don't really like talking on the phone unless it's important, unless it's like maybe a new girlfriend or boyfriend. But generally, you're going to find that a lot of teens have a lot more comfort texting, especially about something that is upsetting to them, if they're reaching out for help. And in this particular case, you have Wade, the practitioner, who is weighing, what are my policies and what am I most comfortable with? And, I really don't want to be texting. However, what is in the best interest of my client? How am I still going to be able to connect with this client? Can I make an exception in this particular case based on what is in the best interest of my client and what is the best way in which to be able to provide her with that temporary short-term support via text? This doesn't mean that you should certainly, suddenly start texting all of your clients and opening that up. The point of sharing this particular situation is just to share that overall point that there are these ethical dilemmas that arise, and there is going to be these gray areas when we're wondering what is in the best interest of our clients and providing, proper client care, and what is also in the best interest of ethics, rules of technology, confidentiality, boundaries, all of those other things ethically that we need to be thinking about in the context of technology. We also have this scenario here. Think about this situation. Given the pandemic health situation, you have notified all your clients that you are going to continue to provide services online using a telehealth platform. However, in one phone call with a client, the client indicates that they do not want to be treated using telehealth and insists that they need to come to see you face to face. They argue that the treatment is inadequate using an electronic platform, and that as a licensed healthcare provider, you have an obligation to not abandon the client and provide adequate care. So here are the questions. Do you have an ethical obligation to open your office to provide face-to-face care for this client? Would the diagnosis of the client make a difference if they were high risk, if they were suicidal? Would your own health status or that of an immediate family member have an impact? So what are your thoughts in this scenario here? Do you think that a practitioner has an ethical obligation? Does the status of the client make a difference? And what about your own status or situation? How would that perhaps influence your decision? What are your thoughts on that situation? Yeah, okay, so there could be some other options here, but you can see where a practitioner would be put into a difficult position, especially when a client is resisting the opportunity to go to telehealth. And let's imagine that they are high risk and they're already accusing you of abandonment. I think any practitioner is going to take a step back and think, what do I need to be considering here? What do I need to be documenting? What are my options? What should be the next steps so that I'm very clearly not abandoning this client and making sure that I'm doing my due diligence that they are receiving the appropriate care that they need? So lots of things to consider here. I do think it's also, as you mentioned, it's important for us to recognize our own biases for and against technology, for and against teletherapy, for and against anything related to social media, boundaries. For example, if you are a practitioner that really believes in more open self-disclosure with your clients, if that's more of your style, You may believe that having more of an open social media presence is appropriate. If you're a practitioner that really does not believe in a lot of self disclosure, you may align and have more of a bias that is more private and more protective and more guarded about your social media presence and sharing. So, part of our ethical response to these dilemmas is recognizing our own opinions, beliefs, and biases.